Hi all, thank you so much for joining in this live today. I'm so excited to have this conversation. Today is World Population Day. Globally, we're approaching 8 billion people worldwide, and in Nigeria, 200 million people. So we're going to have some important conversations around family planning, our sexual and reproductive health rights, the population policy in Nigeria, and so much more. I truly cannot wait for this conversation. But before we start, we're going to have our keynote speaker by Her Excellency Mrs. Toyin Saraki tonight. We're so happy that she's able to join us for a video. She's a global health advocate. She's the president and founder of the Wellbeing Foundation Africa, and also the World Health Organization Foundation inaugural ambassador. So thank you so much, ma'am, for joining us today. I'm going to play the video, and after we hear from her, we are then going to go ahead and have this very, very important conversation. So just give me 1 or 2 minutes and we will hear from Her Excellency Mrs. Toyin Saraki.
Hello. And peace we universally desire. We must invest in our people, their rights and their choices, beginning with women and family planning. Every person should have the freedom to choose how many children they want to have, and the freedom to decide on the timing and spacing of any pregnancy. From protecting themselves and their family's well-being, to preventing unintended pregnancies, including those older women who faced increased risks related to pregnancy and delayed pregnancies in young women who are at an increased risk of health problems and death from early childbearing. Family planning is one of the most effective and well-tested strategies for saving women's and children's lives and for improving health. In February of 2022, the government of Nigeria launched our revised national policy on population for sustainable development, signifying the immediate measures needed to combat the fertility rate, which is increasing exponentially each day in the most populous country in Africa. Paired with the ever-challenging maternal and childbirth mortality and morbidity indices, and a significant education population mismatch in the context of informality and development, Nigeria is at a turning point through well-implemented and sustainable access to modern family planning, counseling on commodities, as well as promoting birth spacing, so we can improve the standard of living for all. Half of our female population in Nigeria are in our reproductive years, and unfortunately, fewer than 1 in 5 married women uses family planning. The limited access due to supply chain failure and lack of investment in education surrounding family planning for young people has had a detrimental effect on our women, girls, and children, putting their health and well-being at risk. As we reach the endemic, we reflect on the devastated supply chain systems around the world, which have made it even more difficult for low-income countries to access potentially life-saving medical supplies services. Fortunately, NGOs such as My Wellbeing Foundation Africa and private sector corporations are working together on innovative methods and policies to overcome these hurdles. The reproductive and sexual health commodity supply chain is one of the systems which is suffering, leading to unsafe, unplanned pregnancies that are fueling unsustainable population growth in Nigeria. The larger the population grows without choice and accessible education and healthcare, the more the difficulties we will see a rise in economic prosperity. A weakened GDP contribute to higher inflation, yet stagnated average incomes, fueling the cycle of poverty, which are already deep-seated throughout the nation. My Wellbeing Foundation Africa frontline staff and midwives continue to ensure that our Mamacare 360 program, which is informed by the World Health Organization's antenatal care model, safely tackles these growing gaps of inequality in our classes, but also at our 6-week postnatal home visit. These one-on-one chats cover sexual and reproductive health and rights, including contraception, spacing advice, and often include informal direct conversations with husbands, partners. Alongside these, our Mamacare and nutrition lift focus on family with iron and folic acid supplementation to combat anemia. We expanded this program through recruiting more midwives and healthcare staff while broadening our reach to more healthcare facilities and healthcare service delivery areas as education and information must be paired. Trusted healthcare staff and a well-resourced primary healthcare system is essential to demolish myths, share information, and create trust within communities. Each year, between 2 and 4 million adolescents undergo unsafe abortions. We owe them so much more than that. We owe it to them to reduce unintended pregnancies and therefore remove the option for unsafe abortion. My Wellbeing Foundation Africa's Adolescent Personal Social Health Education and WASH program believes that young people today should be informed and enlightened as opposed to burdened. Through our programming, we ensure adolescents have access to healthcare that is comprehensive, youth-friendly, and reflects the modern times in which we live, giving them access to compassionate support at every stage so that their dignity and sense of self is protected. Investments in women, adolescents, and infants always bring the best returns. Women are key to achieving the demographic dividend that comes with an interplay of reduced total fertility rate, an expanded base of working-age population, and improved educational infrastructure and healthcare investments. Lack of access and supply chain failure are major factors in why women do not use contraceptives or discontinue doing so. Therefore, establishing, maintaining, and strengthening local supply chains is one of the fundamental components in achieving a demographic shift, economic growth, and zero unmet need for modern family planning within Nigeria to work towards a nation where every child is wanted, planned, and nurtured from birth to age. My Wellbeing Foundation Africa's grassroots advocacy and program implementation allow for an increase in local ownership of health services and supply chain management, which promote improved access and sustainability to family planning programming, creating a foundation for more inclusive, adaptable, and equitable societies. Productive societies uphold human and reproductive rights. In a world of 8 billion, let us work towards a resilient future for all, harnessing opportunities and ensuring rights and choices for all.
Thank you so much, Her Excellency Mrs. Tuyin Saraki, for that amazing speech. As you said, family planning and access to safe voluntary family planning it's a human right, and it's important that women and men feel and know their sexual and reproductive rights. So we're going to get into this conversation today. I have some amazing guests and my co-host who's going to join me. So if you give me 1 minute and we'll get them on and we'll get the conversation started. Hello.
Hi.
How are you? Great. I think everyone's just coming on.
Everyone's just coming on. Hi, good afternoon. Hi, Dr. Hi, Dr. Joyce. Hi, Rhoda. How are you?
Hi, Dr. Joyce.
Hello, everyone. How's everyone doing?
Pretty good. For Margaret to join, Mrs. Margaret, Mrs. Edison.
Peter, we can't hear you.
Yeah,
Can you hear me?
barely hear you.
Oh, okay. Let me come back on real quick.
No, now we can hear you. Now we can hear you.
Oh, can you hear me clearly?
Yeah.
Awesome. Okay.
We're just going to
Well,
wait.
thank you very much. Is it clear? Is it very okay? Great. We have Mrs. Edison now. Fantastic.
I'm just going to.
In the meanwhile, I just want to welcome everyone to this while we get our technicalities together. Happy World Population Day. We were saying earlier how we didn't really know what that meant, but we're hoping that we can, through this conversation, learn a few more things, especially from the expert, Mrs. Edison, once she's able to move on, around what are some key things that we can learn today as we mark World Population Day. I will start first by quickly introducing my co-host, Dr. Joyce Omasere. Am I saying that correctly?
Yes, that's amazing.
Yes. Dr. Joyce is a medical doctor and a health influencer, and she's joining us today, and hopefully over a course of a few more series of conversations around women's health. Thank you so much for joining us as a co-host today. Thank you, Dr. Joyce. And we have also Rhoda, who is not new to us, from Hasty Health Initiative. Rhoda Robinson is, we like to call her Dr. Rhoda Robinson. So in-house, we're gonna call her Dr. Rhoda Robinson. Dr. Rhoda Robinson is joining us today from Hasty Health Initiative. She's the executive director there. Welcome, Dr. Rhoda.
Thank you. That was a pleasure.
And as we're waiting for, okay, it looks like we have Edison. So Edison is Mrs. Margaret Edison is the director of the Population Management and Development Department at the National Population Commission. NPCR_Nigeria is their handle, so you should follow them. Thank you so much, Mrs. Edison, for joining us today. We really appreciate your presence and look forward to a great conversation.
Thank you very much for having me on this platform.
Thank you. And my name is Fifehan Oshikonlu, and I am the family planning lead for the Gates Foundation project here in Nigeria. And so let's just go ahead and get started. I will pass it on back to my co-host, Dr. Joyce, to take us off with the first question.
Thank you so much for giving me your time to speak on this conversation. I start with Mrs. I think it would be nice to talk more about
I think you're cutting out a little bit. Is it just me?
Can you hear me? Hello?
So what I'll do is maybe I'll go on mute while everybody should probably try to go on mute maybe while she's talking. That might help the sound as well.
Okay.
If I know how to do that. Okay. Go ahead. I think we can try again.
There's a bit of here.
Have an echo. I'm gonna go out and come back in. Go ahead, Dr. Joyce. It might be me. I'm not sure.
Me that is echoing, or can everyone hear me clearly?
Oh, it's better now.
Okay, it's better now. Perfect. So I think if we just start while FIFA comes back in, Ms. Rhoda, I wanted to speak to you directly because I think it would be good to understand exactly what family planning is. I think a lot of people are still very much confused on, do I start family planning only when I'm married or in a relationship? Is it a conversation for all? Is it for men? Is it for women? Young, old, those type of conversations. I really want to get down to what exactly family planning is and just explain it so that our audience kind of understands that it actually is or could be for everybody.
Okay. Thanks, Dr. Joyce. Okay. So I think from my experience working with young people and youth adolescents, and as you said, when people hear family planning, the first thing they think about is family. In other words, you need to be married in order for you to actually participate or learn about family planning. And the idea behind family planning is for a person, married or unmarried, to be able to have the adequate information, access to services, and commodities to help them determine and manage their own fertility. And when they want to start having children, how many children they want to have, the spacing of that children, or if they want to have children. So it transcends just the family and the beginning of family planning, but basically it's more like a life choice on how you want to plan your life going forward with regards to reproduction and fertility. So that's
Okay.
basically the idea. So giving people more understanding and a more inclusive way of understanding what family planning is.
Yeah, and why is this important? Why is it important that we speak about this today? I know we've heard from Her Excellency Mrs. Toyin Saraki, who has actually brought up a few points in terms of some of the numbers that we're looking at in Nigeria and our fertility rates, maternal mortality rates, the amount of unsafe abortions we're having. So does family planning really play into this as well? Like, why is this important that we have this conversation?
It's like extremely important. And it's not just important for us to have the conversation, but it's important for us to have the conversation now because Nigeria is at a cliff where if we do not manage our population, we would not be able to, in simple words, like it will go very, very bad for development. Because when you're looking at the numbers, as you said, majority of maternal mortality and morbidity rates, issues of unsafe abortion, issues of young people getting pregnant, unintended pregnancies happen within the ages of 15 to 29. And this is our youth age. And Nigeria currently has a very large youth bulge right now. So imagine if with us having a birth rate of about 5.7 live births per woman, every single person continues that trend. And we have more children being born, a lot of them unable to take care of their kids, increasing the dependency ratio of the population that we currently have, and reducing the amount of people that are able to actually earn an income and improve upon themselves and their lives and make better choices for themselves and use the opportunities that are available. You'll see that we'll be going on a downwards trend when you talk about developments. And that's looking at it on a larger scale, like a more government-oriented or development-oriented scale. Now, when you're looking at it as a person, being able to decide and know when you want to start having kids, being able to decide what kind of contraceptives and when you want to start having using contraceptives, having that knowledge and having access to those commodities and that information is very, very important in helping people decide how to plan the trajectory of their life. Being able to take advantage or build their economic capabilities and further their education and explore more for their own personal benefits. being able to do that is one of the most basic things of having a productive and fruitful life. But when you're saddled with an unplanned pregnancy, negative outcomes from an unplanned pregnancy, STIs that you could have prevented if you had the right kind of information, you'll find that we would have lost a lot of potential across. It's extremely important that we start now and we start in full force because we do not have a lot of time left within this gap of about 20, 30 years that we have from now till 2050 when we're expecting to double our current population. And our economy cannot handle that. We cannot.
Wow.
It's just as simple as that. Yeah.
Wow. Thank you, Dr. Rhoda. You know, it's really important that I like the point that you made that it's for everyone, because at the end of the day, if there's an unplanned pregnancy, both the men and the women are affected if they can't, you know, for any reason afford it, or if they have to cut their education or their, you know, work short for any reason, or sometimes it actually destabilizes the family, you know, because, or when I say the family, the couple unit, because then the man has to go somewhere else completely to find, you know, work, and the woman also, you know,
Yeah.
needs to be home with no support, you know, and with little to no support, and having to depend on family members that may have had to go to school as well, or, you know, get education or work. And so, yeah, it's literally a what's that word called? Like a domino effect, right? On the negative side, when things like these happen and people don't have the information they need. So following up on that question, you know, Mrs. Margaret, what are some fundamental, what are the fundamental sexual and reproductive health rights that we have, you know, as individuals, as citizens in Nigeria, and why should we care about it? Why should both men and women, young people, you know, older people, why should we care about it? Especially ideas such as Planned Parenthood that have been, you know, kind of deemed stigma, or, you know, have been looked down upon or spoken down upon in the past.
Thank you very much. I think I would like to situate the conversation around the young people, around the women, because they constitute the challenges that we have that are playing out on what Dr. Rhoda have just explained. We have a huge population. The population that 70% are below the age of 30, from day 1 to below 30, 29, are 70%. You can, if we go by the theme of this year's world population, that 8 billion equals 8 billion opportunity, 8 billion individuals in the world, and each of them have different sexual and reproductive health needs. So for me, in Nigeria, we have 70% of our population, directly or indirectly, have need for sexual and reproductive health issues. But we are going to zero it down to those people that affect the size, the composition, and the structure of our population. And those are the young people and the women in reproductive age. I'm going to break it down a little bit. Age 10 to 14 is a threat because of the issue of early marriage. There are people that married below the age of 15. Before they celebrate their age of 15, they're already in a husband's house. Another percentage, before they are 18, they're already married. That means reproduction starts. They have a long span to have children. Somebody that starts from 15 to 49, you know how long she has. And if she does not have access to the choices to take decisions for herself, the right to information, the right to counseling, the right to means of spacing those children or deciding when to have, then it's going to affect the size of our population. Somebody who marries early, she didn't go to school, she's not educated, She doesn't have information. She doesn't even know how to access it. So she has been deprived of the rights, first of all, on the other side, the right to go to school. She has been deprived the right to decide when to marry. She has been deprived of the right to decide who to marry. She has been deprived of the right to decide when to start having children. She has been deprived the right to space her children. So her life, her destiny, her potential is truncated from the beginning. Then you come to those who are currently married. We have 19% of our women who want to space or delay childbearing do not have access to family planning, either information or commodity. Another 19% aged between 15 and 19 are already pregnant or already with their first child. So all this putting them together are what constitute the challenges we have, the problem, the setbacks we have in sexual and reproductive health. How do we address that so that we can be able to change the narrative, so that we can move from quantity to quality? So I would say on the onset that this is the beginning, this is the fundamentals that are affecting our population, affecting efforts made at achieving population management, effort made at taking advantage of the youth bulk that we have in the country at the moment. So it moves from the people to planning to policy to implementation, from this community level to the subnational and to the national level. It cuts across both the actors and the non-actors. So it's a huge problem.
Basically, yeah, that's what I'm hearing, that it affects everybody across
Yes.
all socioeconomic, levels.
And I think what I wanted to ask you, Mrs. Margaret, if that's okay, is you spoke about policy, and I mean policy being, I guess, important for us to state what the problem is, what our solutions possibly could be, and then the implementation side of things. So I know we have a revised population policy that I'm sure you've been part of the team that have been working on it, and it'll be really great to kind of understand exactly what this population policy is and what your implementations or the plans are in terms of improving the access to education and commodities for these young individuals, people, women, and men, especially in the reproductive ages. So it'll be great to kind of understand more about the population policy that currently exists.
Okay. Yes, we have a revised population policy. It's called the National Policy on Population for Sustainable Development. And the overall goal of that policy is to improve the quality of lives and the standard of living of all Nigerians. It didn't say some Nigerians, all. Both the present generation to the generations to come. That's why it said sustainable development, dealing with the current and leaving some things for those that are coming to also enjoy. So the population emphasizes so many things. It emphasizes that the girls should be prioritized. They should be given opportunity and rights to education, quality education. They should be given rights and access to information that will shape their lives, that will make them to marry when they want to marry, to have children when they want to have children, to have the number of children they would want to have, and the means to space those children, which I have already reflected. The population policy addresses every segment of the population, whether you are born today, whether you are an adolescent, whether you are in your reproductive years, whether you are a working age population, whether you are dependent or independent, whether you are aging or you are already aged. So it's a very holistic policy. I was just saying to myself the other day, I said, when we launched it, when we had a side event in New York during the 55th session of the United Nations Commission on Population and Development, the Nigerian policy was rated as innovative, and transformative because it addressed everything. And I would say with pride that it is the only population policy that has addressed the issue of COVID. The only population in the world today, population policy that addressed the issue of COVID. It's addressed the issue of gender-based violence. It addressed the issue of sanitation, which Her Excellency talked about in her key message. All the things Her Excellency highlighted in her keynote address to open this conversation are all addressed in the population policy. We have several targets that address all the commitments that Nigeria is signatory to. It has a target to address.
Turn on the lights.
Okay.
Sorry, you can continue. Yes.
Okay. It addressed the 3 zeros, which I know Her Excellency was a signatory to in Nairobi. It's addressed the carrying forward from 1994 to 2014 when the first Cairo agreement came to an end and we had a lot of unfinished agenda. Can you hear me?
Yes.
Okay. And that was carried forward. It also addressed its benchmark by the targets of the Sustainable Development Goal. That means the policy, the targets, the objectives, and the goals align with the Sustainable Development Goals, the Agenda 2030. So we are going to move along. So whenever we are evaluating the Agenda 2030, the policy will be evaluated. When we'll be evaluating the Africa's Agenda 2063, the aspiration of Africa's development, the policy is a part of it. The policy also address the unfinished agenda of the Cairo agenda, connecting with the Nairobi reaffirmation. So it's a holistic policy, and it has a 3-level framework. We have the National Council on Population Management, which is chaired by Mr. President. Then we have the Population Advisory Group, that it is chaired by the chairman of National Population Commission, bringing people from different angles to advise on how to go forward. Then we have the Population Technical Working Group, that is more subnational and more focused on civil society, the subsectoral ministries that are implementing activities that build up to address the population and development, population management issues of family planning, and all that. But the bedrock of all of this is that we must address our fertility. So family planning is at the top burner of implementing that policy. How do we give information to our people? How do we sensitize them? How do we create the awareness for them to embrace family planning? So those are it's a very, very robust policy that addresses everything. So I think that's much. And the strategic plan, like you requested,
I was just about to ask that.
Yes, the strategic plan is developed. We are on the final leg, because for us to fast track implementation, the strategic implementation plan must be ready on time.
Correct.
Between now and August, we should be able to launch the strategic plan for the population policy.
Plans and phases, are these going to be working with other organizations, with like the Planned Parenthood movement? Is that something that we're going to be something similar that we're going to be adopting, where women can go into any women and men really, but can go into a center to get supported by the government, funded by the government, that could get the kind of answer the questions they need, get the kind of advice on contraceptives that they need, or whatever the case is, and talk about the issues that they have. Are there any of these types of plans, within the strategic implementation plan?
Yes, the Population Technical Working Group is made up of the sectorial ministries, that's government that implements, has members from the civil society groups, including the Planned Parenthood Federation of Nigeria. They're one of our key stakeholders in addressing the issues of population management, family planning, fertility issues. So everybody is on board. We have donors, we have partners that are part of that body. And added to that, we have a platform where we call the Community of Praxis. That one is focused on harnessing the demographic dividends. And every player in that group, the focus, for you to harness the demographic dividends, the first level is to reduce your fertility so that your population can transit from plenty to quality, so that you can shape your age structure to allow for good investment to take place. So we have that. And I am the convener of the Community of Practice, and I also a lead in convening the Population Technical Working Group. So all those that are working in the field of addressing issues of family planning, sexual and reproductive health are part of that group. And added to that, when we came back from Nairobi, we established the stakeholders platform, which Her Excellency is a member of that platform. Those who made commitment to support the Nigerian government and the Nigerian people to address our fertility. So we are in finalizing the national action plan for addressing the commitment to have zero preventable maternal death, zero unmet need for family planning, and zero harmful practices that it impedes the work.
Of course, we wouldn't be in Nigeria if we didn't have some.
These are the things that the National Population Commission is working together. So we are working together. We have a robust family at all levels to address issues of family planning, fertility, to reduce our fertility rate. The Federal Ministry of Health is at the lead with us. Then the Association for family planning in Nigeria are also part of that. So it's a big family, and we are all working together to see that Nigeria moves from quantity to quality. Because for you to harness demographic dividends, for you to improve the quality of life and standard of living of the Nigeria, you must reduce the independency ratio, where people who work can earn income, can save, and promote and accelerate economic growth. There are the demographic dividends in Nigeria. Thank you, and over.
Thank you so much. That's amazing. I'm really happy to hear everything that you said, and I'm actually really excited that you are leading this charge because of your depth of knowledge and your. It sounds like your passion really for ensuring that we move the needle towards the developmental focus, right, of Nigeria. I know Dr. Joyce has a question, so I'm going to turn it over to her.
Thank you so much for that. I think it's nice to see that we're also thinking about it in levels, state level, community level, and a federal level, and because that's the best way to be able to actually, look for solutions to all the challenges we get at those levels. But I wanted to come back to Mrs. Roger, if that's okay, and just say, I'm sure you've had a lot of experience within, one-on-one experience with women and people seeking family planning advice and education. And I actually want to know what your thoughts are on how Nigeria is doing so far. I know we have this policy in the works, we have plannings, and we have strategic implementation plans coming through. But what are your opinions on how Nigeria is doing at the moment, and what are your thoughts in terms of what would you like to see? What type of things would you like to see? Because we have someone that we can speak directly to now in terms of what the rest of the community, what us civil servants would like to see. So it'll be great for you to just share your thoughts with us.
Okay. I think, as Ms. Margaret has said, the policy in itself is all-encompassing. And I think one of the questions that a young person, such as myself, a semi-young person such as myself, and other young people, one of the major things that they would want to know is, what does this mean for me?
Yes.
What does this mean when I walk into a facility? What does this mean when I ask a question about condoms or IUDs or implants or things like that. What does this mean when I talk to my partner about um, waiting and spacing our kids and only having 2 kids rather than the 7 kids that his father had or the 20 kids that his grandfather had? What does this mean for me particularly? And I think that's where this partnership comes in, and there's importance for adequate, reliable information and awareness. And it's not just about um, working on at the policy level, which is extremely important. So do not get me wrong, that is extremely important for us to have that framework from the government level that connects the government, private, public partnerships, and other key stakeholders together to ensure that young people and women and men have access to family planning choices, information, and commodities. It transcends that into how that policy and the strategy protects the rights of these young people to actually access those services, and how these policies provide those services. You had asked how Nigeria is doing. Currently, we have less than 15% contraceptive prevalence in Nigeria, and we have such large
That's
number of unmet need for contraception. It's pretty bad. Like, you have tons and millions of women and girls and men who require information and commodities about contraception, but either they do not know how, do not know where, or they do not know what they can get. So it's crucial that at the community level, at the primary healthcare level, we have the structure and resources that can cater to that pressing need. That we ensure that when a young person walks into a facility, not only are they welcome, they are assured of confidentiality, they are assured that they would not be discriminated against based on their age, where they are, who they are, or whatever reason. They are assured that they will get the right kind of information for them to make the right kind of choices. And I think this is where the crux of it really falls, that we are working with a large young population, and our interventions, our solutions need to cater to that particular group of people, need to address the barriers that that particular group of people face. You find that from my experience working with young people a lot, one of the major things that they complain about is the obvious discrimination that they get as a single person
yes,
walking into a facility to inquire about family planning.
huge problem.
So yeah,
Can
so
we double
until we
tap on
can
that?
deal with, yeah.
Sorry, I just want to double tap on that because I know majority of our viewers are these young people, right? Majority of our population are also these young people, and so the fact that exactly the name, in fact, the name family planning alone becomes an issue, right, for them, because it's like, well, I mean, I'm a single woman, I don't even want to have kids.
Yeah.
So how does that, you know what I'm saying? How does that speak to me and my
So
problem
how does
when
that help you?
when I'm in a society that is essentially stigmatizing it as like a family thing, a marriage, you know what I'm saying, requirement, and as a woman requirement in having kids, or you know, in ensuring that I do do that. Meanwhile, there's a policy like, you know, Mrs. Margaret has worked on that states absolutely the difference, right? That says that no,
Exactly.
we encourage, you know, more people to stop that process of reproduction while we're trying to, you know, develop the nation.
Yeah, yeah, and I think that that's really what we need to communicate.
Yeah.
Changing the narrative and the concept behind family planning from the provider's perspective, so it is easier to how do I put this? To increase demand for family planning, basically, from those categories of people who are already discriminated against or sidelined in that process. So it's easier for a young person to walk up to a help family planning provider and say, "Oh, I need information when it comes to contraception. I want to decide whether I want to get an IUD or I want to start using pills." And the not having the feeling that they are being looked at as promiscuous because they are choosing to plan their lives better. So that is something that we really need to work on at the grassroots level, at the ground level, at the community level, online, in schools, in groups, in policies, every single way. Because it's one thing to have a beautiful policy.
Yeah.
It's another thing for that policy to actually change the situation on ground. So that's just basic. So, and then we need that commitment of funding as well. So you can have all the policies you want, but if there is no fund to push commodities from the stores, from the manufacturers into the hands of the people who need it the most, who most of the time cannot afford it, we will still have the same problem. Because a lot of times people cannot afford the options that are available. You'll find rural communities, and a lot of people who have unplanned pregnancies are from rural communities, are very impoverished. So a lot of times getting that commodity to that place, getting that service to that place costs money. And the current policy says that that cost should not be transferred to the end user, which is one of the major things I was looking forward to in that policy. And it should not be transferred. So how do we transfer that from paper to practice?
Exactly.
So that's what we currently need.
And part of that is also investment in human capital development. I'm seeing some comments about, how maybe some doctors, you know what I mean, are actually advising young women, that, the IUD is better for women who've already had kids. Okay, so then how does that help me as a single woman who's never had children, who has no plans, or who has plans, but, doesn't want to be affected by it negatively? Speaking from my own personal experience, I've actually had a series of, nightmarish experiences with the different, options and opportunities.
Yeah.
And that's me that has access, like that, that has an incredible amount of access, right? So how, like you said, how does this policy actually translate to the grassroots, to the majority of the people where they actually know their options and those options are available to them, you know what I'm saying, in a safe way? And I think that's also one of the things that, the education piece of it in terms of the development piece, will be important in implementation, that I'm sure that Miss Margaret is also working on with the, with the family of teams she's working on. Just a quick follow-up question before I also ask for the question for both of you, but I guess I'll start with Mrs. Edison. Around like the digitization, right, of these services. And I know, Rhoda, we were on a panel together, or we worked on a panel together recently where we talked about, some of these solutions, the potential solutions that could also, digital solutions that could help to also reduce the discrimination. Because then when you're using a platform like this, you don't necessarily have to be, people don't necessarily can see you as whether you're young or you're old, married or not. It's just a user asking a question, you know what I'm saying? A user looking for a solution. So I guess the question really is, Miss Margaret, are there any, I would say immediate, right, plans, right, for digitization of some of the, with part of the implementation plan? Are there any digitization plans, right? Or are you planning to work with any platforms or any technology-based organizations that can help in digitizing some of these services?
Thank you very much. Before I answer your question, I just want to make some comments on Dr. Rhoda's what she said. I want all of us to still know that Nigeria is still a very traditional, cultural, and religious country. And that affects some of the things we wish we should have, we would want to see happen in our society. That would lead me to the issue of digitization. That is why in some of the plans attached to extending issues of family planning, comprehensive sexual and reproductive health, young people will always add that culturally sensitive. I don't know whether Dr. Rhoda have come across that balance. They always add that it should be culturally sensitive, because where the bulk of people are creating the challenges, they are all situated in the communities, in the subnational level, where the custodians of culture are mostly
Sorry, is it just
residing.
me? She's breaking up a bit.
So we need to do a lot to reorient everybody.
Yes.
Why I
That's the
say
key
so
word.
is because the message that goes out, family planning, everybody zeroes family planning to taking tablets or fixing the IUD.
Yeah.
And there are myths that says a young girl who has never been married before taking pills or fixing IUD So I want to lead
Yes,
that
I've heard that.
conversation to the issue of, so you see a young person walks into a primary health care center. The counter is the age of her mother, probably knows her mother, knows her father. What do you think he or she will do?
Yeah.
She will start cautioning that child.
Yeah.
She'll put that child in a bad light. She has started having sexual intercourse. She's not a good child. If that girl was a friend to her daughter, she will say, I don't want to see you in my house again so that you will not corrupt my daughter. Even the healthcare workers who are supposed to give the information, they still feel that way up till today. Those are the realities that are facing us. So we must address the fundamentals. When we went to Kigali conference in 2018, and the Rwandans were presenting some of the breakthroughs that they have attained for other African countries to adapt. And I remember that one of the things they said was that they brought parents into the conversation on how to
Yes.
address these issues. So those are the
It's
things
key.
we have to
Yeah.
address. We have to bring the parents into the conversation. We have to bring
Absolutely.
the religious leaders into the conversation. We have to bring the culture, the traditional, the keepers of our culture, that
Yes.
things, the landscape of issues in population and development has moved away from what it used to be. We need to do those fundamentals if we
Yes.
have to move forward. So it is then, if you want to say digitization, fine. Nigeria has a ministry of digitization that address issues of digitization, economy, and all that. And if you check the population policy, that is one of the assignments they're supposed to do, to see how we can use the technology of digitization to expand access to family planning, to give information to people. But for us to do that, you cannot have a blank information from people. We would like to know their age. We would like to know their sex, whether they are male or female. We need to collect some basic information so that we'll know who are the major people that have requirement for family planning. Is it women of reproductive age? Is it currently married women or people in union? Is it the young people who are in secondary school or moving from primary to secondary school? So you cannot just make the digitization, deploy the digitization technology on a blank these things, because you were saying they wouldn't know their age. We need those information, because it has to be mainstream into planning. It has to be mainstream in reproductive health, commodity security, to know which of the commodity is most asked for or required by this group of people and why. So we cannot practice digitized technology blankly. We need some basic information to do that.
We do.
So
I think from what you've said,
so we need, we need that. But you need to address culture, because they live in the community. When they leave their house going to the primary health care, people are seeing them. When they enter there, they are seeing them, and they will be labeled as bad children. But meanwhile, they are not bad. They are trying to protect themselves from getting pregnant. I remember as a young girl in secondary school, when we hang around our male counterpart, our parents used to say, go on, when you get pregnant, you will come back to the house to stay, and you will not go to school again. And those are the only threats they give to them. But it's beyond getting pregnant. Affect that child. If I had got pregnant and I dropped out of school, you wouldn't be talking to me today. So there are some things, and we also, in the lineup of contraceptive, in the lineup of the range of contraceptive, please, I will request that we add abstinence, because Rwanda told us that that is one of it, abstinence. And we educate our children. If they cannot stay practice abstinence, then you do this. So let it be a compound, a complete package of options to choose, but not restricted to you must take drugs, you must put IUD, but you can also abstain. So that's my comment. Thank you.
No, thank you so much, Mrs. Margaret. I think just to even go over what you said, the levels of education in terms of reducing the stigma and increasing awareness is extremely important. And as we were saying, this is from a religious level, from a school level, from a teacher level, and even as a healthcare professional working in the UK and having experience in Nigeria, being able to see the difference in views is very, I don't want to use the word scary, but it's almost like if us as healthcare professionals are supposed to be the ones that women trust to come and discuss their options and get advice from, if we are not, you know, almost feel educated and we're not understanding how important these type of practices are, we're also not doing ourselves or our patients justice. So I think everything you've said is amazing, and we need to actually really address our culture. I just wanted to go back to Mrs. Rhoda and just ask more about, I know there's been a lot of different movements worldwide and what, you know, different examples of what has been done. I know we spoke about digitization. It may be difficult in Nigeria. Not many people may have access to these type of platforms, but what movements or what methods have you seen in other countries that you think may be a good way to apply to Nigeria? Hello?
Oh, Dr. Rod,
You're mute.
here.
I'm so sorry.
No, great. Happy that you were on mute.
Okay, I said, as Mrs. Margaret has said, culture plays a very, very key role when it comes to access to information, commodities, and services. Someone had said in the comments that our health workers are the ones that first and foremost need sexual and reproductive health education first to be able to give that. And while it sounds funny, it's actually true, because there is a certain level of understanding and skill that you need to have to work with young people. And if you are not enabled enough to do that, you'll find out that the right information that you would have given them, they would get the wrong information from somewhere else. And then we live in this bubble where we think that adolescents do not engage in sexual activity. Yet we have majority of unsafe abortions being practiced by adolescents and young people within the ages of 15 to 19 and things like that. So we have the statistics that show us that these young people do not have the right information. They do not have access to the right kind of commodities and guidance that they need to make the decisions that would positively affect your life. And then we need to develop our interventions to solve those problems. At Hasty, we've looked at all aspects of it. We've worked with working with state-established centers, sexual and reproductive health centers for young people, such as in Lagos, the Hello Lagos. We've worked with primary health facilities. We've worked with maternal clinics at the community, local governments, and the state level. We've worked with private health clinics. We've worked with different sectors of stakeholders to understand how best to reach this kind of invisible young people that people do not really see, but they are also there at the same time. And we found out that a lot of times what they really need is that information.
Absolutely.
To tell them that, yes, this is a process or this is a stage in life that you just have to get through. And that for you to have, you need the right kind of information to do that. And we cannot ignore the fact that we are currently in a digital age. A lot of young people have access to phone or the internet. At the minimum, they have access to WhatsApp. How do we, at the minimum, so how do we leverage on this? And that's why we created a WhatsApp bot, such that depending on what you need, you can ask for that information. Do you want to learn about where you can get services? You want to learn where the closest service to you is. You want to learn about where the closest youth-friendly service, because there are two different things. For you to have a health service and the one that actually caters to your needs. So we've been able to do that and then put that information out there. And then also give that group of young people the choice to seek more information. As Mrs. Margaret said, abstinence is the only 100% guaranteed way of preventing unintended pregnancies. But in situations where that is no longer a choice, what other option does that person have? In situations where you're already a married teenager, what other options do you have to make sure that you are still able to make decisions for yourself? Because at the end of the day, sexual and reproductive health does not just affect a person's maternal health, a woman's maternal health, but her economic power, her education, her ability to take advantage of opportunities existing. So it ties into so much more than just her ability to reproduce. So it transcends that aspect of giving birth to children, to how that choice affects the rest of her life. And then, as you see, when a young person starts giving birth at the age of 15 to 19, they have a generation to go of giving birth. They have more than 20 years, and they can continue giving birth every single year. So a single woman can have up to 20 children. I've actually met with women who have 11 children before they were, I think, 28. She had 11 kids already, as in some were twins and some, yeah. So she had 11 kids and she was not 28.
Correct me if I'm wrong, Dr. Joyce, Rhoda, and Miss Margaret, but that does not sound healthy at all for anybody.
It does not. It does not. It is not. It cannot be. Your body cannot take that.
That come from that. There's a risk in every single.
Sorry?
We're also not thinking about the risk of that comes with pregnancies and all of that all through those years. So for you to have 11 children, you need to understand the strain that has on the body, the amount of exposure you're getting, or just the risk that woman themselves into.
Any mental turmoil of having to manage 11 children.
Yeah. And I think on average in Nigeria, it's almost like the fertility rate is at least 5 children per. And
5 kids, yeah, 5, 6 kids.
According to where you are, so there's a lot that we need to look into. But I think
and then just to add to that while we are just looking at one woman, a man can do that in multiple circles.
This is true.
Yes. So majority of the time, while we focus on the woman, we forget the male aspects as well. that they also need to understand that just because you can does not mean you should. So we need to start pushing that out there as well, and ensuring that they understand that it's a role that they need to work hand in hand, especially for those who are married or who have partners that they have sexual relations with. That you are also responsible, because we have a lot of young people. I live in like this semi urban community where you find a lot of young, barely 25, already have 3 kids, 4 kids from 2 different women. And it's like the norm. So while we are teaching women how to take responsibility, how to understand what their body rights, we also need to educate the men on respecting that and being responsible for the number of children that they have, because that is also key in managing that population growth as well.
Yeah. Couldn't agree more. Couldn't agree more.
Awesome. Thank you so much, Rhoda, for these amazing takeaways. I think we have one question. Dr. Joyce, did you want to maybe look at it? I think it's from Jason. It's probably...
I can't see. Oh, okay. Let me see. One second. Oh, yes. So we have a question. I'm going to put stop. It says, to what extent have the efforts to reduce the birth rate in Nigeria been successful? I guess.
Been successful.
Either one of... Yes. To what extent have these efforts been successful
In reducing the birth rates?
Okay. Want me to say something?
Yes, ma'am, please.
Okay. I just want to, first of all, address some of the things that was raised by Dr. Rhoda. You mentioned all the different stakeholders and categories of people and persons and groups that you work with to address the adolescents' sexual and reproductive health issues. But I didn't hear you mention the parents, particularly the mother. Please, for you to make a progress, I would like you to include the parents, particularly the mothers, from the onset in conversation, that saying they should have access to information or whatever that will help them to stay away from unintended, unplanned pregnancy, that these are the reasons. So you first of all educate the mother. I would like using the mother to educate the children, rather for them. If you send the message to their telephones and their mothers pick up the phone, it's going to put them in trouble. So let's include the parents, the caregivers, the people that are staying with in this conversation, please. Whenever you are calling for your meeting or advocacy, whatever, sensitize them, inform them, educate them. That is not to spoil the morale of the children, but to make them be who, to realize their potential and become useful to themselves and to their society. I think with that, we will be able to make a lot of milestone. We'll be able to make progress in addressing the issues of young people, sexual and reproductive health matters in Nigeria. Then coming to the issue of birth rates, I always tell people, I said, yes, family planning, good. But when you educate a girl up to the minimum of secondary school, there are certain things you don't need to tell her, she will know what to do. So one of the key things we should do to address high birth rates or high fertility rates or rapid population growth rate is to make sure that the girls are enrolled, are retained, are kept in school to complete their schooling. Even when they drop
Very
out
important.
and have children, please bring them back. Whether they are dropouts, whether they are out of school, if we can ensure that every girl child has the basic education, some of the challenges we have having to do with family planning, sexual and reproductive health, addressing the HIV issues and all that, they will have the basic information. They will know what to do. They will read and know how to address this issue. So going forward, we should emphasize the girls' education as one of the fundamentals. Quality education. When they're educated, when they're in school, they exchange information with their peers. They exchange information, they hear, they know what to do, they know how to take decisions, they share their fears with them. And also let our mothers, the mothers at home, also share in this information. They can educate their children, not just threatening them, but educating them why they should keep away from getting pregnant and staying in school to complete their schools. All these ones will help. But all of these options are inside the population policy. I wish I can share the copies with you. Maybe after this conversation, I'll find a way to send a soft copy with to you.
Yeah.
So, and everybody, including people like Dr. Rhoda, they have stake in that policy. We have assignments, we have responsibilities to all of us, including every one of us in this conversation. We have responsibility, we have stake in that policy. We call it the people's policy. It's for all of us to join hands together, to be involved in implementing that policy. Pick the one you know you can work with and work with it, bringing us together as a family to make sure that our girls stay in school, they don't get pregnant when they don't want. Please give them education. Let them marry when they want to marry. Then they marry who they want to marry. Let them be able to have a bodily autonomy.
Yeah.
Have the means to the information to whatever to space their children. And for those who are currently married, the government of Nigeria makes family planning free in all public facilities, so they can have access there. Now, in addition, the civil society and other stakeholders are supporting with the consumables, because before they will go there, they will say, oh, go and buy needles, go and buy cotton wool. But I think that gap is being bridged now. So all public facility, the government of Nigeria is funding the supply of commodities in all public hospitals. So it is free. So we advise and we suggest to women of reproductive age, to currently married women, to go to government facilities to have access to those quality contraception, quality information, quality counseling. And where it is they find it difficult, they can reach out to the Federal Ministry of Health, the State Ministry of Health, the primary healthcare system, the civil society group like Dr. Rhoda, who can also guide them to have the adequate information. I think that's the few words I can say. Thank you, and over.
Thank you very much, Mrs. Margaret. I think we're coming to a close now, to the end of the live. I think we can actually probably have this conversation for another 2 hours. It's amazing to be able to speak with you. So passionate about autonomy over our bodies and making the right decisions and education. And so I just want to thank you all for coming on. And I'm going to hand over to Fifa now and see if there's any last words she has as well. And then we can go from there.
Yes, thank you so much, Dr. Joyce, Dr. Rhoda, and Mrs. Margaret Edison. Thank you so much. You've dropped some serious gems today. We're absolutely snapping and goosebumps all over. Just knowing that there are people, behind this policy and in the government that are actually working for our good when it comes to women's health. Right? We know that this is going to take some time. We are not unrealistic of the terrain that we're in. We know that this is a very traditional community, and we know, right, that there's a lot of sensitization that needs to happen. But the fact that there is an actual plan for that, right, the fact that there's actual push for it, and there are people like you and Dr. Rhoda, right, and Dr. Joyce too, right, in these spaces, make it very comforting for us, at least, to be able to hope for the future of our nation, for our young girls and of course even men. And so just to close out, I just want to ask for one word or one sentence that each of you would like to leave as a key takeaway from this session. I mean, it's been an incredible conversation, and like Dr. Joyce said, this is not going to be the last conversation about this. We can keep going on and on. So what we're going to do is we're definitely going to be back. We're going to have more conversations around this. We're going to try to dig a little deeper into that policy and find some things that, you know, each of us can implement in our own small spaces and in our own societies and in our own, within our own power, and influence centers that we can actually make help to, of course, push these policies to actual implementation and execution. So my key takeaway is the fact that there are actually services for young people, right? And to access, and that there's the policy actually supports young people and single women as well, right? And that there's opportunities to talk to people like Dr. Rhoda, and that there are digital opportunities to connect to get your questions answered via HACI, the HACI initiative. I think I probably said more than one sentence there, but please don't copy me. But I'll ask Dr. Joyce to give her one a key takeaway, and then Mrs. Margaret and Dr. Rhoda.
Okay, so I think my key takeaway here is that family planning is for everyone. It's for men, women, young, old, single, and married. And because it has that family in front of it and there is some stigma, doesn't mean it's not for you. And another one, I'm not going to follow in your footsteps, but another one is that education at all the different levels are important.
Yes.
Parents, of religious leaders, of schools, and rather than fearing,
healthcare workers,
scaring people, of healthcare workers, rather than scaring and threatening young girls into not doing something, we should be educating them and encouraging them and empowering them. So I've learned so much from this conversation. So thank you guys so much.
Thank you, Dr. Rhoda.
Thank you very much. We look forward to working with all of you to implement the population policy, so that we can achieve population management in Nigeria. Thank you.
Thank you.
Thank you so much.
Okay, so my turn now. Okay,
Yes.
so I think my key takeaway is is that the government is serious about family planning, and so we all should be serious about family planning. So it's not just about one person; it's about all of us. So that's my key takeaway about it.
Amazing.
Amazing. Jinx.
Thank you.
Okay,
Thank you so much, everyone, for joining us today.
Thanks, everyone.
I'll be saving the
Thank you.
live so we can share it on our individual channels and platforms, and just continue to keep the conversation going. It's very, very important. Thank you. Thanks to
Thank you
everyone.
very much.
Thanks for everyone that
Thanks,
joined.
everyone.
Thanks for
Bye.
amazing.
Please convey our greeting to Her Excellency. Thank you. Bye.
Yeah.
We will.
Thank you, Mrs. Margaret. Thank you very much.
Thank you, and bye. Bye.